Hello everyone, welcome back to Coastal Living. I told you we had an action-packed show today, so here are our next guests. Please welcome Dr. Paul Kennedy with Kennedy Dental Care and Orthodontics, and of course the familiar Elliot Garza with MD Monthly. Thank you all so much for joining us today.
Thank you for having us.
Thank you, Clarissa.
We're very excited to have you. I am personally, because I've got questions. My son is 5, he's about to lose his first tooth, and we're having this conversation about, okay, it's probably time to take him to the dentist. How do we prepare him for that? A lot of kids have a fear of just the word doctor, dentist in general. So at what age should a child actually begin the screening process with his teeth?
Yeah, that's a good question. Actually, it's recommended around the time their first tooth comes in or by age 1. So it's okay. It's never too late to start. And, but the reason is we get kids used to coming in early. Yes. And so that first visit isn't scary. Or if their first visit is for a problem, then it can be more scary. So yeah, we want to, I mean, there's some good videos out there and information, but as a pediatric dentist, we're geared for kids, and so that's our mission, is to make it really fun and a fun experience, so they like coming in to see.
Absolutely. So we want to get them warmed up, get them familiar with the dentist. Why else is it really important to start getting them involved at an early age?
Well, it's important because dental decay is the #1 childhood problem, disease in children. It's 5 times more common than asthma. Wow. And we all know asthma is very common. Yeah. Well, it's 5 times more common than asthma. And but it's mostly preventable. It's a preventable disease. And so when we get kids in early, it's important for parents or the caregivers to come in so we can educate them on what we know to prevent these problems, prevent the disease. So absolutely.
So tell me, okay, we're all ready to go. What do we expect from our first visit? How do we prep our little ones for their first dental visit?
Well, I think it starts at home. You know, most of the prevention starts at home. You brush their teeth, talk about brushing, and just telling your child they're gonna come in, we're gonna brush their teeth just like at home, but we're gonna teach them about how to take care of their teeth. And we have special instruments that we use to look in their mouth. They may lay back. You can practice having them lay back and you look in, pretend at home.
Yeah,
you can do that, play dentist at home.
Good idea.
So that all helps to get them ready to come in.
I love it. That's actually a really cute idea. Let them be the dentist, and then you're the dentist. Take turns. That's good prep idea.
Yeah.
Okay, so tell me about the services that your offices offer.
We are primarily children-focused dental practice. We have a number of dental specialists, mainly focused on children. We also provide orthodontic care, braces. A lot of children, as they get older, have crooked teeth, have functional problems. So we're experts in that area as well. And we have an orthodontist as well on our team that can handle those problems as children get older.
Absolutely. And Elliot, just so we don't have you sitting here looking pretty on the sidelines, what was the reason that you chose?
Well, he's a very strong staple to the community. I mean, is it 50 years now?
That's right.
Well,
we celebrated 50 years this year in practice. My dad started 50 years ago, so we celebrated this year.
It's a family practice, which is awesome, because you know a little bit about what you're doing.
Yeah.
So, very cool. There's a picture of you and Pops right there. Wonderful.
Yeah. So with 3 locations, and I mean, I had braces twice when growing up.
Let's see the grill.
Yeah, no, but you know, when I walked into their dental practice, it's very welcoming, animated. There's TVs. We didn't have that growing up.
Oh, of course not.
You know, it was just like, oh my God, who's this strange guy? You know, but it's very welcoming. It's not scary. So especially with the family history and the reputation they have in Corpus Christi, more than so, I'm humbled that I even know their profession and Dr. Kennedy as well.
Amazing. Yeah. So you mentioned 3 locations. Tell me where those locations are.
So we're on Alameda, next to Driscoll Children's Hospital, Saratoga on the south side, and in Calallen.
Oh, great. Okay, so all the way in Calallen, and a lot of you folks are watching the show, we know. You can visit paulkennedydds.com for more information. And before we go, real quick, what was so special about 2019 for your company?
Well, it was the 50 years. We've been in practice 50 years since my dad started, and so it was really, we celebrated this year that. It was really fun to celebrate that and realize how long that my dad's been here, and we've continued that his tradition.
Wonderful. So, we love it. Well, congratulations on that, and thank you so much for joining us.
Thank you for having us, Clarissa.
Absolutely.